Think you're ready for the CNA exam? Communication questions are tricky. They test empathy, safety, and professionalism all at once. I've prepared 25 carefully selected MCQs that feel just like the real exam. Watch till the end and comment your score. Let's see who gets a perfect 25. Question 1. A resident with a hearing impairment is having difficulty understanding you. What is the best action to take? A. Speak as loudly as possible into the resident's ear. B. Face the resident and speak clearly at a moderate pace. C. Use high-pitched tones to get the resident's attention. D. Stand behind the resident so they can focus on your voice. Correct answer is B. Facing the resident allows lip reading and facial cues, improving clarity without distortion. Shouting or using high tones can make speech harder to understand, especially with hearing aids. Standing behind removes visual communication support. Question 2. True or false? If a resident is in a coma, the CNA does not need to explain the care they are providing because the resident cannot hear them. A. True. B. False. Correct answer is B. Hearing may still function even when a resident is unconscious. Speaking during care preserves dignity and professional standards. Choosing true ignores respectful communication principles. Question 3. True or false? Using medical jargon like ambulate or NPO with a resident is an effective way to show you're a professional healthcare worker. A. True. B. False. Correct answer is B. Medical jargon confuses residents who lack medical knowledge. Clear language builds trust and ensures understanding. Saying true prioritizes sounding professional over effective communication. Question 4. You are caring for Mrs. Smith, who has late-stage Alzheimer's. She is agitated and keeps saying she needs to go home to feed her mother, even though her mother passed away years ago. What is the best communication technique? A. Remind her firmly that her mother is dead and she is in a nursing home. B. Ignore the comment and continue with her morning bath. C. Use validation therapy by asking her what her mother liked to eat. D. Tell her she can go home as soon as she finishes her breakfast. Correct answer is C. Validation therapy acknowledges feelings instead of correcting reality. Confronting her about death may increase agitation and distress. Ignoring or falsely reassuring fails to address her emotional need. Question 5. A resident's daughter is shouting at you because she thinks her father's room is too cold. How should you respond? A. Shout back so she knows you are busy with other patients. B. Tell her she needs to leave the building if she cannot be respectful. C. Walk away and report her to the nurse immediately without speaking. Or D. Listen quietly and then say, I understand you are frustrated. Let me see how I can help. Correct answer is D. Empathy and active listening reduce tension and show professionalism. Shouting or avoiding the situation increases conflict. Option D focuses on problem solving respectfully. Question 6. You are helping a resident who speaks very little English. He is pointing at his stomach and grimacing. What should you do? A. Tell him to speak up because you cannot understand him. B. Wait for a family member to arrive before taking any action. C. Use a picture board or simple gestures to identify if he is in pain. D. Assume he is hungry and bring him a snack tray. Correct answer is C. Nonverbal tools help overcome language barriers safely. Ignoring pain cues or guessing can delay proper treatment. Waiting for others risks resident safety. Question 7. Which of the following is considered a barrier to effective communication? A. Giving advice or using cliches like everything will be fine. B. Maintaining eye contact with the resident. C. Asking open-ended questions. D. Summarizing what the resident just said. Correct answer is A. Clichés dismiss emotions and stop meaningful discussion. Eye contact and open-ended questions improve communication. Summarizing clarifies rather than blocks understanding. Question 8. When documenting a resident's behavior in the medical record, the CNA should A. Leave it blank if they aren't sure of the medical term. B. Record their own opinions about why the resident is angry. C. Use objective observations like resident is crying and rubbing right knee. D. Use a pencil so errors can be easily erased later. Correct answer is C. Objective documentation includes only observable facts. Opinions and pencil entries are legally unsafe. Accurate records support proper care planning. Question 9. If a resident is visually impaired, how should the CNA enter the room? A. Knock and enter silently to avoid startling them. B. Touch the resident's arm first so they know you are there. C. Shout from the hallway before entering the room. D. Knock and identify yourself and your position immediately. Correct answer is D. Identifying yourself provides safety and orientation. Touching first may startle the resident. Silent entry or shouting is unprofessional. Question 10. What is an open-ended question? A. A question that only has one correct answer. B. A question that can be answered with a simple yes or no. C. A question that requires a detailed response and encourages talking. D. A question that is asked to someone who cannot speak. Correct answer is C. Open-ended questions invite detailed responses. Yes-no questions limit communication. This technique improves assessment quality. Question 11. Which of the following is an example of nonverbal communication? A. Writing a note in the chart. B. Nodding your head while the resident speaks. C. Speaking to the nurse on the phone. D. Giving a verbal handoff report. Correct answer is B. Nonverbal communication includes gestures and body language. Nodding shows engagement without interrupting. The other options involve spoken or written language. Question 12. A resident tells you in confidence that she is being mistreated by another staff member. What is your communication responsibility? A. Keep the secret to maintain the resident's trust. B. Tell the other staff member to stop what they are doing. C. Report the information to the charge nurse immediately. D. Wait to see if it happens again before saying anything. Correct answer is C. CNAs are mandated reporters and must report allegations immediately. Keeping it secret endangers the resident. Reporting ensures protection and investigation. Question 13.
When communicating with a resident who is depressed and quiet, the CNA should A. Force them to go to the activity room to cheer up. B. Sit with them in silence for a few minutes to show support. C. Tell them that other residents have much worse problems. D. Avoid their rooms so they can have their privacy. Correct answer is B. Therapeutic silence provides emotional support. Forcing or minimizing feelings increases isolation. Presence communicates care and respect.
Question 14. What is the proper way to answer the facility's telephone? A. Hello, who is this and what do you want? B. Nursing home, please hold. C. Identify the facility, your name, your position, and ask how to help. D. Just say hello and wait for the caller to speak first. Correct answer is C. Professional greetings reflect facility standards. Identifying yourself clarifies your role. Other options are incomplete or unprofessional. Question 15. A resident is angry because his call light was not answered quickly. What should the CNA say? A. I was busy with a real emergency, so you had to wait. B. I'm sorry for the delay. I am here now. How can I help you? C. You aren't the only person in this building who needs help. D. The other CNA was supposed to answer that, not me. Correct answer is B. Apologizing validates feelings and reduces anger. Defensive responses escalate tension. Option B focuses on respectful care. Question 16. Which of the following describes active listening? A. Looking at your watch while the resident speaks. B. Thinking about your next task while the resident is talking. C. Giving the resident your full attention and providing feedback. D. Interrupting the resident to correct their story. Correct answer is C. Active listening requires full attention and feedback. Distractions cause missed information. This builds trust and accuracy. Question 17. If a resident has aphasia, difficulty speaking after a stroke, the CNA should A. Finish their sentences for them to save time. B. Use short, simple questions that can be answered with a nod. C. Stop talking to them since they can't answer back. D. Speak to them as if they are a small child. Correct answer is B. Short yes-no questions reduce frustration and support communication. Finishing sentences or speaking childishly is disrespectful. Ignoring them prevents safe expression of needs. Question 18. Which of the following is a subjective statement? A. The resident's temperature is 101.2 degrees. B. The resident says they have a headache. C. The resident ate 50% of their breakfast. D. The resident has a red rash on their left arm. Correct answer is B. Subjective data is what the resident reports feeling. Objective data can be observed or measured. Correct distinction ensures proper documentation. Question 19. When talking to a resident who is in a wheelchair, the CNA should A. Stand over them so they have to look up. B. Sit or crouch down to be at their eye level. C. Talk to the person standing behind the wheelchair instead. D. Lean on the wheelchair while speaking. Correct answer is B. Eye-level communication promotes respect and comfort. Standing over creates imbalance. Ignoring or leaning is unprofessional. Question 20. A resident tells you he's scared of dying.
What is the best response? A. Don't say that. You have many years left. B. Everyone dies eventually. It's just a part of life. C. Tell me more about what is making you feel scared. D. I'll go get the nurse to give you something to relax. Correct answer is C. Open-ended responses encourage emotional expression. False reassurance shuts down discussion. Listening provides immediate support.
Question 21. The CNA is giving a report to the nurse about a resident's fall. What information is most important? A. What the CNA thinks the resident was trying to do. B. Exactly what time the fall occurred and what was observed. C. That the floor was probably slippery from the cleaning crew. D. That the resident is always trying to get out of bed. The correct answer is B. Objective, time-specific facts help accurate assessment. Opinions and blame are inappropriate. Clear observations support safe care.
Question 22. Which of the following should not be discussed in front of a resident? A. The weather outside. B. The activities planned for the afternoon. C. Your personal problems or staff conflicts. D. How much of their lunch they enjoyed. Correct answer is C. Personal conflicts violate professional boundaries. Residents should not hear staff issues. Communication must remain care-focused.
Question 23. When a resident is talking to you, what does paraphrasing mean? A. Writing down every word they say in the chart. B. Copying the resident's accent. C. Telling the resident's story to another resident. D. Repeating what the resident said in your own words to check for understanding. Correct answer is D. Paraphrasing confirms understanding. It allows clarification if needed. Other options distort meaning or breach privacy.
Question 24. If you are angry at a coworker, what is the best way to handle it at work? A. Wait until you are in a private area to discuss it calmly. B. Argue with them in the hallway so the nurse hears. C. Tell the residents how mean the coworker is being. D. Ignore the coworker's help when they try to assist a resident. Correct answer is A. Private discussion maintains professionalism. Public conflict disrupts care. Calm resolution protects teamwork and safety. Question 25. When leaving a resident's room, what is the final communication step? A. Just wave and walk out the door. B. Tell them you'll be back whenever you have time. C. Tell them to stay quiet so they don't bother the other residents. D. Ask, is there anything else I can do for you? And ensure the call light is in reach. Correct answer is D. Offering further help ensures complete care. Confirming the call light promotes safety. Other responses are dismissive and incomplete. If you really want to pass the CNA exam, don't just watch. Pause and answer every question yourself. Write down mistakes. Understand why the correct answer is right. Practice a little every day instead of cramming. Consistency builds confidence, and confidence passes exams.